This is Dr. Bev Knox, and you are listening to my psychology tutorials. Learn psychology while you sleep. Typical prenatal development begins with fertilization and ends with birth, lasting between 266 and 280 days. That's usually between 38 to 40 weeks. It can be divided into 3 periods: germinal, embryonic, and fetal. The germinal period is the period of prenatal development that takes place in the first 2 weeks after conception. The embryonic period is the period of prenatal development that occurs from 2 to 8 weeks after conception. During this period, the rate of cells intensifies. The mass of cells is now called an embryo. The fetal period, lasting about 7 months, is the prenatal period between 2 months after conception and birth in typical pregnancies. Growth and development continue their dramatic course during this time. 3 months after conception, the fetus is about 3 inches long and weighs about 3 ounces. It has become active, moving its arms and legs, opening and closing its mouth, and moving its head. The face, forehead, eyelids, nose, and chin are distinguishable, as the upper arms, lower arms, hands, and lower limbs. In most cases, the genitals can be identified as male or female. By the end of the 4th month of pregnancy, the fetus has grown to 6 inches in length and weighs 4 to 7 ounces. At this time, a growth spurt occurs in the body's lower parts. For the first time, the mother can feel arm and leg movements. By the end of the 5th month, the fetus is about 12 inches long and weighs close to a pound. Structures of the skin have formed, toenails and fingernails, for example. The fetus is more active, showing a preference for a particular position in the womb. By the end of the 6 months, the fetus is 14 inches long and has gained another half pound to a pound. The eyes and eyelids are completely formed, and a fine layer of hair covers the head. As early as 6 months of pregnancy, and we're talking about 24 to 25 weeks after conception, the fetus for the first time has a chance of surviving outside the womb, that is. In infants who are born early, between 24 to 37 weeks of pregnancy, usually they need a little help to breathe because their lungs are not fully mature. By the end of the 7th month, the fetus is about 16 inches long and weighs about 3 pounds. During the last 2 months of prenatal development, fatty tissues develop and the functioning of various organ systems, like the heart and kidneys, for example, steps up. During the 8th and 9th month, the fetus grows longer and gains weight about another 4 pounds. At birth, the average American baby weighs 7.5 pounds and is about 20 inches long. Although prenatal care varies enormously, it usually involves a defined schedule of visits for medical care, which typically includes screening for manageable conditions and treatable diseases that can affect the baby or the mother. In addition to medical care, prenatal programs often include comprehensive educational, social, and nutritional services. Exercise increasingly is recommended as part of a comprehensive prenatal care program. Exercise during pregnancy helps prevent constipation, conditions the body, and is associated with a more positive mental state. Another recent study revealed that exercise during pregnancy improved mothers' perception of their health. Prenatal care is also very important for women in poverty and immigrant women because it links them to other social services. Some prenatal programs for parents focus on home visitation. A recent research review concluded that prenatal home visits were linked to improved use of prenatal care. Research evaluations indicate that the most successful home visitation program is the Nurse-Family Partnership created by David Oles and his colleagues. The Nurse-Family Partnership involves home visits by trained nurses beginning in the second or third trimester of prenatal development. Nature writes the basic script for how birth occurs, but parents make important choices about the conditions surrounding birth. We look at the sequence of physical steps that take place when a child is born. The birth process occurs in stages, takes place in different contexts, and in most cases involves one or more attendants. The stages of birth. The birth process occurs in 3 stages. The first stage is the longest of the 3. Uterine contractions are 15 to 20 minutes apart at the beginning and last up to a minute each. These contractions cause the woman's cervix to stretch and open. As the first stage progresses, the contractions come closer together, appearing every 2 to 5 minutes. Their intensity increases. By the end of the first stage, contractions dilate in cervix to and open in about 10 centimeters, which is about 4 inches in length. For a woman having her first child, the first stage lasts an average of 6 to 12 hours. For subsequent children, this stage typically is much shorter. The second stage begins when the baby's head starts to move through the cervix and the birth canal. It terminates when the baby emerges completely from the mother's body. With each contraction, the mother bears down hard to push the baby out of her body. By the time the baby's head is out of the mother's body, the contraction comes almost every minute and lasts for about a minute each. This stage typically lasts approximately 45 minutes to an hour. Afterbirth is the third stage, at which time the placenta, umbilical cord, and other membranes are detached and expelled. This final stage is the shortest of the 3 birth stages, lasting only minutes. Methods of childbirth. Key choices involve the use of medication, whether to use any of a number of non-medicated techniques to reduce pain, and when to have a cesarean delivery. Natural and prepared childbirth. For a brief time not so long ago, the idea of avoiding all medication during childbirth gained favor in the United States. Instead, many women chose to reduce the pain of childbirth through techniques known as natural childbirth. Today, at least one medication is used in the typical childbirth, but elements of childbirth and prepared childbirth remain popular. Natural childbirth is the method that aims to reduce the mother's pain by decreasing her fear through education about childbirth and by teaching her and her partner to use breathing methods and relaxation techniques during delivery. Another method similar to natural childbirth is known as prepared childbirth. It includes a special breathing technique to control pushing in the final stages of labor. Normally, the baby's head comes through the vagina first, but if the baby is in a breech position, the baby's buttocks are the first part to emerge from the vagina. In 1 out of every 25 deliveries, the baby's head is still in the uterus when the rest of the body is out. Breech births can cause respiratory problems. As a result, if the baby is in a breech position, a surgical procedure known as a cesarean section or a cesarean delivery is usually performed. In a cesarean delivery, the baby is removed from the mother's uterus through an incision made in her abdomen. The benefits and risk of cesarean sections continue to be debated. Some critics believe that there are too many babies delivered by C-section in the United States. More C-sections are performed in the U.S. than any other country in the world. In 2009, 33% of babies in the United States were cesarean deliveries, a 60% increase since 1996. Almost immediately after birth, after the baby and its parents have been introduced, a newborn is taken to be weighed, cleaned up, and tested for signs of developmental problems that might require urgent attention. The Apgar scale is used to assess the health of newborns at 1 and 5 minutes after birth. It is important to remember that although things can and do go wrong during pregnancy, most of the time, prenatal development go well. The postpartum period is the period after childbirth or delivery. The period lasts for about 6 weeks or until the woman's body has completed its adjustment. Physical adjustments in the postpartum period include fatigue, evolution, which is the process by which the uterus returns to its pre-pregnant size 5 or 6 weeks after birth, and hormonal changes. Emotional fluctuations on the part of the mother are common. Postpartum depression characterizes women who have such strong feelings of sadness, anxiety, or despair that they have trouble coping with the daily tasks in the postpartum period. Postpartum depression occurs in about 10 to 14% of new mothers.